Hello everybody, it's Melissa Cady, the Challenge Doctor, trying to get in another live video for you before it goes dark. Just got done with the walk, but I was asked by a friend of mine what the difference between an MD and a DO is. Essentially in this country, MDs and DOs are equivalent from the standpoint of can specialize in any field. It could be, a neurosurgeon, a primary care physician, family practice, pediatrics. I do anesthesiology, also board and pain medicine, so I'm a DO. It means Doctor of Osteopathic Medicine. MDs, although they don't actually refer to themselves as allopathic medicine, many people in alternative types of medicine will consider it allopathic medicine. But essentially your MD and DO comes from your first 4 years of medical training. So most people get their college degree or most of that college training before they go to medical school. So when you get an MD, it's 4 years of medical school. When you get a DO, it's 4 years of medical school. And so when you go out into an internship, which is the first year of training afterwards, after that year you can actually get a medical license to practice in a particular state. And so any training you do after that, which is like a residency or a fellowship, allows you to enable you to actually take a board certification test, and whether it's an oral or a written, always written, but usually there's an oral exam as well for certain specialties. So an MD or DO can do any of the residencies or any of the, as far as the MD, there's MD residencies and fellowships. It gets very confusing no matter, even if you're in the medical field. But MDs and DOs, essentially the medical training in the first 4 years is where that distinct difference starts at. However, with DOs you learn an osteopathic manipulative medicine, or OMT, osteopathic manipulative treatment or therapy. There's different ways, and they're changing those acronyms. But it's essentially assessing and treating the patient's musculoskeletal system and other systems with your hands. And MDs don't typically get this training. However, they can go get training in certain locations to add that additional skill. The reality is a lot of people that are DOs end up maybe not using their DO skills in the sense of the OMT or OMM. Has been described in the past both ways. So the interesting thing is that some people say, oh, DOs, let me let this car go by. But I have people say, oh, I love DOs, and I immediately stop them because every single physician is distinctly different. And not every DO practices the same. Just because you're taught a certain way in the first 4 years of medical school doesn't mean that you're going to carry on that philosophy of, the osteopathic or OMT or OMM that I spoke of. Also, people say holistic people, DOs are more holistic. Technically in our philosophy it's supposed to be that way, but I have met plenty of MDs that are more holistic than DOs, and so I never really put people in a certain bin. I think you have to really look at how that particular medical professional is actually taking care of and looking at that patient amidst a very difficult medical system that doesn't allow you to spend the time you should with patients. So MDs and DOs are both physicians, and in the past there was some stigma that went along with DOs in the past that they couldn't get into MD school. I will tell you outright, I've been accepted into MD school at the same time I got a DO acceptance. It was a choice of mine to go to DO school. Some people may say they would have rather gone to MD school and only got into a DO school. It is different for every single person. So I encourage you not to label anyone, but definitely in this country, MDs and DOs are equivalent if they did their training here in the US. If you meet a DO from another country, say in Australia or New Zealand, they're considered osteopaths, and I wouldn't say equivalent to chiropractors, but in general they're more musculoskeletal based, looking at the whole patient from a musculoskeletal and whole body system, but more of a manual approach, and they can't prescribe medications or do surgeries. So it depends where they did their training for DO. It's all based on your first 4 years, and like I said, we merge into the system in the medical system here in the United States, so MDs and DOs can do anything that each other does. We just happen to learn an extra skill whether we use it or not. So I hope that clarifies. If you have any questions, please leave a comment below, and if you want me to talk about anything else in particular, please let me know. I'll add it to my list of things to discuss and hopefully bring you some more clarification. And I hope you all have a great night, and I'll see you on the next Facebook Live.